Hello, I'm Faiezal Anam from BG21 BG20110268. I'm from Group 1, Section 103. Here I will present about the individual task disease in environment. The topic I've chosen is malaria disease. The introduction of this topic is malaria is a mosquito-borne infectious disease that affects humans and other animals. The causes of this topic is the malaria is caused by single-celled microorganisms of the Plasmodium group. The disease is most commonly spread by an infected female Anopheles mosquito. The mosquito bite introduces the parasites from the mosquito's saliva into a person's blood. So we move to the symptoms of malaria disease. The signs and symptoms of malaria typically begin from 8 until 25 days following infection, but may occur later in those who have taken anti-malaria medications as prevention. Initial manifestations of the disease, common to all malaria species, are similar to flu-like symptoms and can resemble other conditions such as sepsis, gastroenteritis, and viral diseases. The presentation may include headache, fever, shivering, joint pain, vomiting, hemolytic anemia, jaundice, hemoglobin in the urine, retinal damage, and convulsions. The classic symptom of malaria is paroxysm, a cyclical occurrence of sudden coldness followed by shivering and then fever and sweating. Occurring every 2 days, there is tetany fever in PPVX and pre-oval infections. In every 3 days, cotton fever for malaria, P. falciparum infection can cause recurrent fever every 36 until 48 hours or least pronounced in almost continuous fever. Severe malaria is usually caused by P. falciparum, that is often referred to as falciparum malaria. Symptoms of falciparum malaria arise from 9 until 30 days after infections. Individuals with cerebral malaria frequently exhibit neurological symptoms including abnormal posturing, nystagmus, conjugate gas palsy, that which is failure of the eyes to turn together in the same direction, opisthotonus, seizures, or coma. So, the prevention of the malaria diseases is the risk of disease can be reduced by preventing mosquito bites through the use of mosquito nets and insect repellents or with mosquito control measures such as spraying insecticides and draining standing water. Several medications are available to prevent malaria in travelers to areas where the disease is common. Occasional doses of the combination medication sulfadoxine pyrimethamine are recommended in infants and after the first trimester of pregnancy in areas with high rates of malaria. As of 2020, there is one vaccine which has been shown to reduce the rate of malaria by about 40% in children in Africa. A preprint study of another vaccine is shown 77% vaccine efficacy, but this study has not yet passed peer review. Effort, effort, effort to develop more effective vaccine are still ongoing. So the additional information about the malaria is I will give you guys 11 facts about the malaria. First, malaria is a serious, sometimes fatal disease that is spread by mosquitoes who have been infected by parasite. by a parasite. The disease is spread when mosquitoes feed on humans. Next, the malaria breeds mostly in warmer climates where there is an abundance of humidity and rain. Said that malaria exists in 103 countries worldwide, affecting 3.3 billion people. But about 90% of malaria-related deaths occur in Saharan Africa. The majority of those affected are children under the age of 5. You can raise money for life-saving mosquito nets in Africa by hosting a basketball tournament. Sign up for nets for nets. Next, based on recent data, 59 of those 103 countries are currently meeting standards needed to reverse the incidence of malaria. Next, in the US, about 1,500 cases of malaria are found every year. Next, common side effects of malaria are high fever, chills, headache, and other flu-like symptoms. Severe illness and death can normally be avoided if the disease is properly treated. Next, an infected person may start feeling symptoms anywhere from a week to a month after they are bitten. With some rare forms of malaria, the parasite remains dominant and an affected person will not become ill for up to 4 years. In 2012, 207 million clinical cases of malaria were recorded worldwide. Uh, six 627,000 cases were fatal. Pregnant women are extremely vulnerable to malaria. If the disease is contracted during pregnancy, it can be passed to the infant or result in low birth weight, which decreases the baby's chance of survival. The last but not least, travelers coming from areas without malaria often have low immunity and are very vulnerable to the illness. Prevention is possible if you visit your primary care physician. The last one is malaria is not contagious disease. It cannot be contracted through contact with an infected patient, sexually or otherwise. That's all for me. Thank you.